Hey guys, Dr. Tim Uselton here with Trinity Integrated Medical. In one of my earlier videos, I mentioned a condition called peripheral neuropathy and how we're board certified. Well, today I wanted to kind of explain how it is that we can properly diagnose peripheral neuropathy, because it's very difficult to diagnose. Most doctors, if they hear your story and say, I've got this numbness or this new burning in my feet, without much else to it, they will diagnose you with peripheral neuropathy. And that's not always the case. And if they do diagnose you with peripheral neuropathy, they don't really know the cause of it because they haven't done enough to figure out what that cause could be. So the way that, throughout our board certification, we learned to properly diagnose it. The easiest way to diagnose it is literally taking what's called a punch biopsy. You can look up punch biopsy if you'd like, but it's no different than if you found a lump on a breast and then the doctor said, we don't know what the lump is, let's take a little biopsy. And they insert a teeny tiny little needle almost to puncture, and then it grabs the skin through the skin and grabs some tissue and pulls it out. It's about half of the size of a grain of rice. But we do those in the areas where you're having that peripheral neuropathy symptom. So we might test you on your ankles, we might test you on your wrists, if it's in your hands, but in reality, all we're doing is we're taking a tissue sample and we're sending that tissue sample off to a lab. That lab will actually take that tissue sample, they will dye it and stain it with red stain, and then they will look at it under a microscope. And now we know, based on a person's age, how many small density nerve fibers they should have in that little 1 millimeter square piece of skin and tissue. So they count them one by one. And the older you get, the less you're expected to have without symptoms. But if you have symptoms, then they've been damaged. They get damaged in one of two ways, or both of these two ways. One is they decrease in quantity. So they count them and say, you should have 7 to 8 in your age category, and we're only counting 2. So you're severely decreased in your quantity of those nerve fibers. The second way is they look at the quality of each of those nerve fibers, and they know how they should look and how they can actually look on the microscope. They can be bent or crooked or broken. And those are called morphological changes. And when you're starting to have morphological changes, they can predict that you are having early onset peripheral neuropathy symptoms. And then in some cases, they get both. We have people that have decreased quantity on their results, as well as the quality of those particular nerve fibers are no good. So that's the way we technically diagnose it. We don't do it based off of just a symptom, based off of a history of you saying, yeah, I've had numbness for several years now. None of those things can truly properly diagnose peripheral neuropathy. The next thing that we do is we want to rule out that that's not a blood flow issue to the nerves, because if you cut the blood circulation off to the particular small density nerve fibers, they will start to show the same symptoms, yet there's no peripheral neuropathy cause, it's just lack of blood flow. And so if there's an arterial blood flow issue, we do an additional test called a TM flow. It's checking the autonomic nervous system between sympathetic and parasympathetic, and it's switching your body back and forth, and it's measuring how your blood flows to your extremities while you do so. So we know that sympathetic nervous system means your fight or flight system, and that's when your heart rate increases, your blood pressure might go up a little bit, your respiration will go up a little bit, and it does so to prepare you to either fight a person or to run from a dog that might be after you. That's your fight or flight. That's your sympathetic kicking in. Your adrenaline goes real high. The opposite side of that system in the autonomics is your parasympathetic nervous system, and that's also known as your resting or digesting nervous system. That's when everything is suppressed. It's not heightened. You don't have increased blood flow and blood pressure and respiration rate. You have decreased blood flow, decreased respiration rate, decreased blood pressure. So our testing for the TM flow test takes you back and forth between the sympathetic and the parasympathetic side of your autonomic nervous system. And it's basically telling us if the communication between your brain and your heart are in good shape, because your brain is controlling this, and it tells your body, I'm going into sympathetic, so heighten everything. Or I'm going into parasympathetic, so suppress everything. and now it goes back and forth. We put blood pressure cuffs around your ankles. We put a pulse oximeter on one hand and a blood pressure cuff on the other arm, and you lie down during this test, and we push your body from sympathetic to parasympathetic back to sympathetic. It's nothing like a stress test. It's called an autonomic nervous system test is what the actual testing is called, but the brand of machine we use is a TM flow. So we do a TM flow test and a punch biopsy on the very same visit. We send the tissue sample off to the lab for those results. We get the results from the computer on the other test, and it calculates your blood pressure and your respiration rate and all those things while we're testing you. And then together we put those two results together, and we can tell you with a very, very high probability. In fact, the results come back that you are positive for peripheral neuropathy, and it's either mild, moderate, or severe, or you have early stages and early signs of it with morphological changes on the punch biopsy. But those two tests really set us apart as a clinic, I believe, because most clinics are not testing to see that you definitively have it. People come in here and say, oh, I've been told I have neuropathy, and we test them and they don't. They've got a pinched nerve. That hasn't caused the damage long-term on the nervous system yet. Other people come in and say, I had numbness and it all went away. I got on gabapentin and now I don't feel it. And we test their nerves, and the nerves are definitely still damaged. One important thing that I'll leave you with when it comes to peripheral neuropathy is, by definition, it is a degenerative condition. That means that over time it gets worse. Very, 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 very rarely would over time a degenerative condition actually get better. It does not improve. If it's bad now, in the future it'll be worse. Now, whether that future is tomorrow or next week or next month or next year or next decade, I don't know. No one can predict that, depending on your condition, how severe yours is, what caused it. I just went over 3 or 4, maybe 5 causes. There's probably another 6 or 7 that we could talk about, but those are the main ones that people come in here with. So, it's degenerative, and it means it's going to get worse. It's not going to get better. So you got to do something about it while you still can, while you can still stand, while you can still walk, while you can still drive a car, and you can feel the pedals underneath you. We have patients coming in here that are on walkers that within a few weeks, they graduate to canes, and then a few weeks after that, they're walking without their cane because their balance is so much better. It's the lack of balance that the long-term peripheral neuropathy causes that leads to the biggest issues in life. We can deal with numb feet, but we can't deal as well with falling and breaking a hip. So I'll leave you with that. That is my talk about how we properly diagnose peripheral neuropathy when it comes to patients that we see in this office. It's Dr. Tim here with Trinity Integrated Medical. If you have a comment, then go ahead and leave it. If you would like more information about our clinic, then write to us. And thanks for checking out my other videos. And I look forward to hearing from you soon. Take care and have a great day.